Good afternoon, everybody. Welcome to our January information sharing session for care coordinators. And folks are still joining. We have a change in agenda for this afternoon. I have a little bit of it showing here on our screen. We did formally have scheduled DPA staff to come and answer questions. We, of course, have gathered those questions that you had for DPA, and DPA is working on getting the answers to you. So most of us should know how to work this webinar and know how it works. In the handout section, there are two documents that you could download if your device allows downloading. One of them is an agenda, and the other one is a document that you probably already had emailed to you, which is a updated guidance on the use of attestations, which will be part of what we'll talk about today in our session. As always with our care coordination info share sessions, we don't issue a certificate. We'll email you. We'll email you, and the title of the email will say, keep this email because it suffices as a certificate for attendance, and you'll get 1 hour care coordinator CEH for that. So those of us here with you today are, of course, myself, Kara Thrasher Livingston, and our training team with me, Cassandra Lynch and Delight Mells, and our care coordination support liaison, Katsoa Lipinskis. So welcome to all of us and welcome to you. And we'll get started here. All right, next on my agenda, I have walking through the SDS Training Academy. Let's just review the agenda real super quick. So before we start on the first topic, we'll walk through the Training Academy, which is what we're calling our learning management system, SDS Training Academy, and a few topics around that. Today, we'll talk about Full Lives, what you'll need to do to register and attend Full Lives itself, and then for credit for CEH and renewal training. And we also have, we want your ideas on topics for Full Lives and formatting of Full Lives. We'll get those with a poll. We'll do that today. And we'll talk a little bit about attestations. Lots of questions came in around attestations and requirements and things like that. So we'll get a good look at that in a little bit here. So in the meantime, go ahead and write in your questions about these topics, and we'll do our best to answer them. As always, if we can't get the answer to you right away, or we don't know it right away, we'll get you an answer in time and share it with our group. And okay, so Delight, I'm gonna pause my screen again, and I'm gonna go ahead and call up our learning management system, AKA SDS Training Academy, and then you can direct me through your presentation. Okay, so
sure.
You're talking.
Yeah, no, we're just gonna do a walkthrough. First of all, Happy New Year's to all of you. I hope you had a wonderful holiday season and you're ready for 2023. We've been working on what you've probably been hearing us refer to as the LMS. Like, what does that mean? Like, what's up with that? And we're recognize that you don't need yet another acronym set, so we've redubbed this as SDS Training Academy. This is our learning management system, much like Blackboard or maybe other learning management systems that you've been exposed to before in different avenues, but this one's just going to be for SDS and its certified providers. We've been preparing a course catalog of courses to start off with and to enroll people with. And you can expect us to be launching later this month. And we will be holding kind of a having some materials ready for you so that you can engage in this again. This is our first, if you were at the provider info share in December, you had a similar experience of walking through the learning management system, or the academy. And what you're looking at right now is the dashboard of a learner when you first come in. This is what your homepage, and you would have to first register with the academy before you would get into this phase. And so you would somehow connect with SDS training because you're a new care coordinator, or maybe you need critical incident reporting. Connecting with us will help you register your account. And then the next big thing is that you get enrolled in certain classes. Some classes you'll have to request enrollment because it'll be for like a renewal exam, right? Like you can't just automatically take it. You would request being enrolled. And then there are other classes that you can self-enroll for. So you can see that Kara has an enrolled class for settings on her dashboard. If she wanted to look at all of the classes, she'd go to the site home. And from here, you can get a glimpse at the total catalog of the classes currently in here. So if you scroll down, Kara, you can see that to the right, we have SDS's mission, and to the left, you have our available courses. If you keep scrolling down, you can see that there's a little arrow going into a door at the corner of the Adult Protective Services Mandatory Reporting Training. So all the way down towards the corner to the right, that's an indicator that this can be self-enrolled. You don't need to contact anybody. Once you've registered, you can go in and take whatever classes you want if you see a little arrow like that. But if you scroll up and you see like Introduction to Harmony, it doesn't have one of those. That would be something that you'd have to request enrollment into that course. None of you really need to take Introduction to Harmony anymore because you're already in it, but we're planning on kind of developing the curriculum within Introduction to Harmony so that you can refer back to it for different concepts and themes. It wouldn't be required, and something that's in development. One of the big things that you will really need to keep track of is what happens after you complete a course. You'll get a certificate. And for you to find your certificate, at the moment when you complete your course, you'll be able to download the certificate right away. But for whatever reason, you can't find what you downloaded and saved, you can always go back into the class to find your certificate. So I know that Kara's actually completed her certificate for settings, so she can go into, you did, right? Or is it critical incident? I don't remember which one you finished.
Either one. I think either one. I'll do critical incident. I'll
So
go into
clicking in, okay. So if you click into the class and she scrolls all the way down to the bottom, she'd be able to get the certificate of completion for finishing the class. In other classes, before you complete it, you wouldn't be able to look at the certificate. You'd have to meet the other requirements of the class, maybe an activity, maybe a quiz, maybe you have to watch a whole video. It'll depend on the course. But once you complete the conditions for the class, you'll then be able to access the certificate and download it whenever you want. Okay, so that'll be kind of the methods for you to be able to pull your certificates on demand. We did want to let you know that we're planning on using the Academy for completing your full lives engagement. So if you want to use full lives for your renewing certification training, or for 16 or for your 16 hours of CEH, you'll have to enroll into the Academy and you'll have to complete the 2 different engagements. So that's going to be one of the first big carrots, if you will, for you to go in there and be able to download your certificate after you complete the engagement activities. So that's
okay.
that was our walkthrough. Questions?
I just want to let everyone know it is very important when you get ready to do full lives that you do both. Make sure you sign up for both. I don't know if I'm there yet for to talk about this, but since it's going to be in our academy, we're going to open it up so that you can do sign up in there so that you could get your CEH and so that you can get your renewal. Okay, so you need to let us know whether you want to do one or the other. As we know in the past, we have had issues where you say that you sent the information or did the information but didn't receive get your certificate, and we're trying to alleviate majority of that. And I might be out of place saying this at this time, but I'll come back and say it again. Okay, just remember to do both.
No, that's great timing. What you can expect is that there'll be two courses, one for the CEHs and another for the renewal training. You can do
Just
both of
like
them,
last time.
or you can just do one of them. But you're gonna have to, these won't be self-enrollment classes. Like you won't see the little arrow to click in and enroll yourself. We will have to enroll you. So you will have to tell us if you want those classes or not.
Right.
We
And
haven't
what
finished mapping them, so
right.
there might be pieces to it, like you have to do it within a certain time frame. We haven't mapped that out yet. We're just kind of giving you, um, sometimes I think we're all just so busy and we have so much content of information coming at you. We're trying to give you these soft warnings of of what's coming, okay? Because so that it's not totally new when it's due. So we're just trying to give you some pre-teaching here and preparing you for what's coming and how we're going to be transitioning. So Kara's pulled up the agenda again because we're now going to be talking about full lives. So that's pretty exciting. She just highlighted the dates. It's April 3, 4, and 5, and you'll have to work with our friends over at the Alaska Training Cooperative and Centers for Human Development. They're going to be the ones that are managing the registration. Um, and we had some questions for you. Right now, we're comfortable with going back to in person, but there has been some questions about if there should be a virtual option. That's been something that people have been, when we're having the committee meetings. There are a couple of you in this session that are on the committee, um, that we were just trying to figure out some of the logistics, and we were curious about you all, how you feel about that. What would be a good learning environment for you? Do you have a preference, um, for virtual, in person, or maybe both? So Kara just launched a poll, so if you wouldn't mind giving us your chance to, your take on it, to vote on what your preference would be for participating in the Full Lives 2023. Um, just know it's no big deal either way. We're just interested in your feedback. Oh, so we're getting some feedback that they can't select virtual for whatever reason. Oh, never mind. We're good. Everyone's able to make their selections.
Okay, looks like almost all of us have voted. Last call, last couple, 30 seconds. All right, 10 seconds more. All right, polls closed. Let's see, show poll results. Okay, I'll share it. Folks asked me to do that before and I wasn't sure how to do it, but I just figured it out. All right, it looks like 9% of us prefer in person, 30% of us prefer virtual, and 61% prefer a combination. And 88% of us who are in attendance today voted. So it's okay, the staff can't vote, meaning, us, the ones that put the webinar together. So close enough, majority, just an informal poll. Okay, awesome.
Very cool. Thank you so much for giving us your feedback on it. There's just, we just want to be modern. Like, what works for you? Like, not necessarily go back to the old way. Maybe the new way is better. Maybe we can do a combination of both. Like, we can explore it. So I appreciate you guys participating with us on that. I think on our agenda, we did have some specifics on the qualification, like the parameters for getting either, because I think this is where everyone's getting a little steered off course here. It's two things. There's two things you can have happen. You can get your renewal training complete or your 16 credit hours. So they're two separate things that you can do at the same time, okay? We've seen that kind of be confusing for folks. They'll do part of the full lives assignment, or maybe they didn't request the full assignment for both pieces, and then much later they are looking to get their CEHs or their renewal training and not realize that they only did part of it. So that's what Cassandra was wanting to make sure that you all understood, that like you should do both. Yeah, okay. Do both.
Can I explain it a little bit? So if you sign up for Full Lives and you pay your money to go to Full Lives, that means you will receive your CEH. Full Lives will not give you a CEH through Alaska Training Cooperative. You will get your CEH from us. But that is only for people who have paid their money to go to Full Lives. When you go to sign up, we're going to acquire a list from Full Lives to check to see who has signed up. We will come up with more information a little bit later to give you exactly what we need from you to give to us, okay? Or we may not have anything for you to give to us because we may just go off of your signing up, paying your money through Full Lives. The second part to this is you will have to register in our academy so that you will be able to do the assignment. Okay, so once we know who you are, we will end up giving you a link so that you could sign up, so that you could do the assignment if you want to get renewal certificate. If you want to get a renewal certificate, you'll end up getting a link from us so that you could sign up for Full Lives assignment. Okay, but if we'll figure out the part for the CEH, and more likely it'll be just as simple that we could go off of those who have signed up and paid their money to get your CEH. Okay, so you got your CEH part and you got your renewal part. Renewal, you're going to have an assignment to do in our academy. Don't forget. Now, if you don't sign up to join our academy for renewal and get a link, that means you opted not to do that. So later you wouldn't be able to come back and say, well, I did it and I didn't get my certificate. Your name will be in our system already, in our system for Full Lives. Okay? I'm hoping I'm making this very, very clear for us so that we won't have many mishaps at the end.
Is the screen stuck on the poll still?
Yep.
Yes.
Darn. I don't
Sorry.
know how to get it to make it not do that.
Can you
I'm not
reshare
sure.
your webcam maybe, or your reshare your
Oh, here we go.
screen?
Let me
Okay.
reshare my screen.
It's
Okay.
2023 problems, guys. Things have not been fixed over the
You know,
long
we're
weekend.
Last time it wouldn't hear my mic.
oh
So
my gosh.
anyway, I think it's okay now.
Yeah, you fixed it. We're
Fix
trying
it.
to be modern, guys. Be patient with us. We're that Alaska modern where it's just a little lag and there's a little lag. But we're getting there. So there are some good questions that came up in the chat, and some of you are asking, well, how do I sign up for both the CEHs and the renewal training? Like Cassandra said, step one, like do the conference, pay for the conference, all that. That's step one. Step two is going to be that enrollment component. And when we do that, I have another question in line with that of like, well, when can I register for the academy? Soon, very, very soon, most likely by the end of the month. There's a couple of logistics that we're working out that we just want in place before we also want to give you some tools, like just so that you have like an at a glance handout, and we're finalizing some of those pieces. So we're making sure that it's smooth for you to go in and that we have that ready for you. We're doing some testing with different users. So that's happening. That's part of what's going on. So there's a couple of other questions that are kind of in the parameters of like a renewing care coordinator that I'm seeing in here. And I get the question because there's been some changes to certification. Don't worry, that we're actually preparing a specialized training for you on this, because there's a lot of, like questions about CEHs for care coordinators with the changes to how certification timeframes are going. So that is going to be a whole topic. So stay tuned. You're going to be well informed when we get to that, and that's coming up very soon as well. The big difference is that your CEHs are separate from your renewal training. They're not the same thing. You have two separate things that you're working. So every year, whether you're renewing or not, you need to have your 16 CEHs on your renewal year. Yeah, every year. And then when you have a renewal training is for when you renew as a care coordinator. That's
And
when
they
you
do
usually
not
do
carry CEHs. Your renewal certificate do not carry CEHs.
So just remember they're separate. That's why they're going to be separate. They're separate for full lives because they're separate. If we didn't have full lives, they're still separate requirements. So that's the big distinction here. So we're going to informally ask you to chat in some of your ideas for full lives. We do have some of our folks that are here repped on the commission, but we're always interested in if there's anything that in your past experience for full lives that you really liked and that you really want to see again or experience again. Or if there are certain topics that you would like exposure to in that, you're paying for this conference, is there anything that you want to be touched on, that we can ensure that we reach out to those kind of subject matter experts and ask them to put in proposals for the conference. Because what you may not realize is that we ask Alaskans to propose workshops and sessions, and then they're reviewed by the committee and determined if they will fit the theme and the nature of the entire conference. So if there are ideas that you have of I would really like to have more content about planning meetings, we can approach that kind of skill level, that skill set within the community, and ask if they would do proposals. So thinking about that. I'm seeing that you guys are putting in information. So thank you for that. So we'll give you guys a second to kind of throw in any ideas that you have on that, maybe more than a second.
Okay, Delight and Kara, can I answer the 2 questions? It said, now I am hearing that we need 16 hours a year for CEH and additional full life 16 hours for the year of renewals. It's getting more confusing than ever. Okay, what we're saying is you need 16 CEHs per year to complete your renewal, right? So basically it's 32 hours that you would need for your 2-year recycle, right? That's whether it's full lives or not. Full lives will give you 16 of those. We're not giving you 32, we're giving you 16. You still have to get your other 16 from somewhere. We do trainings every month. Like this info share gives you 1 hour. So you will get 12 hours from us just by joining the info share. And then in between that, quarterly, we do another training of some sort that will give you another hour. So that is 16 hours right there if you just do stuff with us. But you can do stuff with anywhere else, get your trainings, your classes, or whatever you want to call them, anywhere else, and make up your 16 hours. You only need 32 hours. What we're doing with Full Lives is crediting you for coming to Full Lives, taking time out of your day for 3 days to do Full Lives, and we're trying to offer you something as an incentive, which is 16 CEHs. Now, on a plus side, we said, well, hey, you went to Full Lives for those 3 days. You listened to everything that had to be said. If you do this assignment, you don't even have to take a renewal exam. We're going to give you a certificate, a renewal certificate for doing this assignment. So we're really trying to help you guys. We know you're busy. We know you got a lot of things on your plate. So we're trying to find the most convenient way of helping you by giving you 16 CEHs for just showing up, just for registering and paying your money and going to those classes. So that's 16 CEHs automatically. That's the bottom line. You still got 16 to get from somewhere else. And then the other part to it, if you do the assignment to tell us whatever we ask about Full Lives, you get a renewal certificate. So now you don't have to go and take a renewal exam because you already have it. So is that clear? I'm not sure if I can make it any more clear than that. And if you have any questions, you can always call me or email me. Thank you.
There's some great ideas here and lots of questions, which is awesome. Lots of good ideas for different sessions. There was a good question or a question here about grants for Full Lives. Alaska Training Cooperative does offer some scholarships and travel reimbursement for those who, are coming from outside of Anchorage, but that is managed through Alaska Training Cooperative. They'll make that clear when they make registration open. So the actual venue where it will be in Anchorage has not been confirmed yet, but the dates have been confirmed. So there's that. How much does the conference cost? We're not sure yet. That'll come out from Training Cooperative, and we'll of course convey that. Yeah.
Great thoughts. Really appreciate it. You guys are really putting in a lot of great ideas and helping us be able to take that to our committee and give them some some parameters of what would be beneficial for you. And I really love some of the ideas that you have kicking around.
So there was a comment about training for holding planning meetings. And what else? Notes. They're training for documentation. of clinical documentation, you know, like your clinical note or whatever.
Fair hearing was one that I
Fair
saw.
hearing. Yep, that was a good one. DSP presenters and DSP subject matter experts. Some workshops taught or co-taught by waiver recipients would also be good. Something to make the event fun and refreshing for attendees, something fun so that people don't get too burned out. It's a big event. Yep, these are all great ideas. People working as finding supports for people who experience behaviors or display behaviors that we find challenging. Round robin, where more experienced care coordinators can share learned experiences and resources for families going through the IEP process. Some sort of solution for non-existent EMOD program. I acknowledge the challenges around accessing EMODs, so thank you for that. DPA solutions, path planning training. It's person-centered, if you mean the classic path, person-centered planning. Really great ideas. Of course, we're on the committee and some care coordinators here are as well, so we can help convey those as a group. IDD and dementia as the lifespan has increased. There might be a training on our YouTube channel about that because we have had the Alzheimer's Resource of Alaska do training about experiencing dementia with IDD. But that's another great idea. How to maintain records for 7 years electronically. What exact records are mandatory for saving for 7 years? Everything. 7 years from the date of service to the person. Yep, everything. Okay. Other thoughts from the team before we go to the next topic?
Just gratitude for you all's willingness to throw these ideas out there. Like we really are, we're like using you as a think tank because we want these materials to be meaningful for you. It's supposed to be enriching professional development. So like how enriching is it if you're like, I know all this stuff, or you know, like we want to know what you're curious about, really. So thank you for asking and sharing, and we love that. Thanks.
Complex behavior collaborative, behavioral health waiver options. What is that? What is the behavioral health stuff? Loss of a client, helping family after. Okay, so this is like oriented to end of life and after end of life, what to expect from Medicaid, grief, recoup, how to help a family after the passing of their loved one. Great, great topic. And also planning for end of life and, you know, adulthood or change of guardian or aging out of guardian. Yeah. Social Security, what happens? All those things are great. Thank you. Review of grants available to clients. Okay, super duper. Appreciate that. All right, so now it's just about 2:35, 2:36 actually. Let's talk for a few minutes about attestation. I know that Kat had sent us all 2 documents intended to clarify current requirements around attestations and electronic signatures. And of course, to get it out of the way, electronic signatures are available and accepted as valid now and forever. Okay, so an electronic signature is when a person signs a document electronically using virtual methods, whether it's an Adobe document or a DocuSign or something where they put in their signature, they have a stored signature or something like that they've done through the system itself. That is all electronic signatures, right? So we're not prepped to review that a whole lot, but we are getting a lot of questions about attestations. So we'd like to provide some guidance around that. let's talk about that. All right. So currently, attestations are when a person is authorizing a document with you. Typically, this is over the phone, and they're not physically signing, and they're not virtually electronically signing a document. And this is a flexibility available to us because of Appendix K, due to, of course, the public health emergency, which is ongoing. 6 months after the federally declared end of the public health emergency, Appendix K flexibilities will end. So we're just talking about this one particular Appendix K flexibility. Signatures, and we looked at the messaging that's gone out, and it's been different and here and there. We can definitely understand why there's confusion, because it has been confusing, which is why we're hoping to clarify and maybe give some common denominator type thought processes around this. Signatures to verify attestations has always been required in some way or another. In the very early stages of the public health emergency, we were saying to go back and get them and turn the documents in to SDS. So since then, it has gone on for a long, long time, much longer than anybody had expected. We are not requiring anybody to turn in signed documents that have formerly been attested to and processed and long gone by. Okay. So we're asking, the essence of this is that you should be getting signatures on attested to documents and keeping it on file, not turning it into SDS, right? So the best answer around this issue is for your current clients, well, 6 months after the end of the public health emergency, attestations will no longer be accepted because the flexibilities won't be in place anymore, okay? So for your current clients or your current clients upon the end of the PHE, it's hard to imagine because it's not done yet. If at that time you are visiting in person or your person has the capability to do an electronic signature, have them sign either face-to-face or electronically, okay? We do have new regulations around visits that will come into play upon the end of the public health emergency. So there will be at least a face-to-face visit at that time in which you can ask them to sign, or they can sign electronically anytime. If you're not visiting in person, you can use attestation until the flexibility ends. I say if here because you are not required to visit virtually. If people, there may be those of us who are visiting face to face in a safe, socially distanced manner at this time. Okay. So if you're not visiting, if you are visiting in person, or the person is capable of doing an electronic signature, meaning like they have the resources to do so, ask them to sign and keep the document on file. If you're not visiting in person, you could use attestation until the flexibility ends. Plan on getting signatures upon the end of the flexibility and plan on keeping them on file. If the person refuses to sign, or there's been so many attempts and you're unable to get that person to, you're unable to obtain a signature, what you want to do is document your attempts and keep that on file. All right, so we're not talking about, these are some of the questions that have come in. How about if the person died? How about if the guardian's no longer the guardian or the rep's no longer the rep? How about people who I didn't have until, later? What about people that were with somebody else? Do I have to go back and get all those records? Best answer is no, okay? Not for people who've passed away. Obviously, asking about maybe having a family member sign or something like that. No. Not for people for whom you are not the active care coordinator. As a best practice, if you're faced with a situation we haven't addressed here, document your attempts to get the signature or reasons for not having a signature and keep that on file. It's the same method you'd use for any other situation where you weren't able to comply with the regulation. such as a client refusing to sign or didn't show up for a visit or something like that. It's not possible for us to come up with every single scenario and list them out. But what you're looking at here is if you're not able to do this, you need to document your reasonable attempts to get the signature and keep that on file. These are not to be turned in to SDS. These are to be kept on file in preparation for if you were to experience an audit. There was a question about, do we have to go back and get clients to sign all the case notes? Clients are not required to sign the case note. So that is your agency's practice, then your agency would have to, answer the question. All right, I'm looking at the questions here. Go ahead, add to it. Go ahead.
Yeah, one of the questions was, would I need to go back to somebody that's no longer active on waiver? So they're still alive, but they're not on waiver. Would I need to go back?
My best answer to that right now is no. I mean, if they're not active on waiver, they're not obligated. I mean, you could try, there's nothing, maybe you had a great relationship. Like, yeah, sure, I'll just do it. Yeah, okay, I could do that for you. Then maybe you could, but if they're not currently active on waiver, there's nothing compelling them to sign anything anymore, and you'd have to document that and put that in your file as to, that's why we're imagining that a good advice would be to start when you can getting signatures, and to especially electronic, because that's kind of easy, right? If the person is, I don't say able, but they have the resources to do so. If they can do electronic signatures with you, then I would say to go for it. If a person is accepting face-to-face visits with you, you could go for it. If the person will sign something and drop it back in the mail to you, they could just put it outside. You could stop by their house, drop off a document, come back and pick it up later. There's ways that you can get this done without being face-to-face. So
we are wanting to give you the heads up on this because we recognize that it will be a lot of logistics in this context, and that, to sort this out, it'll take time. And so what we're really asking you to do is start thinking when you're getting ready for your planning team meeting. Look at the client's back notes, like how many Appendix Ks have been done that were verbally attested to, looking at them so that when you contact your client, you can say, hey, so we have 3 that we need to sign, when we do the planning team meeting, and that that you have, as you renew in the next couple of months, that you can start incorporating that as part of your analysis of the case and preparing for the planning team meeting. This verbal attestation is really, it's one of the flexibilities that didn't stick. It's really only limited to the PHE. And really your goal in this is, if you don't get the signature, then you should somehow memo to file it, to make a case note for your records of I don't have this client anymore, whatever. And we're not even saying to do that for your previous records, because their case moves on. But if you can't get it, it's a good practice to document that you attempted it for auditing purposes. We honestly don't know how this stuff is going to be audited, so we're giving you advice based on best practices for when you have a scenario where you can't meet the requirement. Like Kara said, if you tried to make contact with someone and you called them and they didn't answer, what would you do? You'd write it down. You'd be like, I tried to call this client on this day. You'd put it in your case record. This is the same kind of thought.
Outside of audit, this is also to cover kind of one of those COA kind of things, in case somebody ever disputes, having signed this or agreeing to whatever services or whatever unit. So it kind of covers covers you in your work, and kind of just, you want to make sure that you have documentation that the person is aware of what they attested to, and then they are able to see it in writing as well, and then they sign it as well. So on top of audits, this is also,
I am seeing some of your thoughts on stamps and people being unable to physically sign or electronically sign because of their physical abilities. It should be something that maybe you need to talk about in a planning team meeting, because this person has to sign for other things in their life as well. So how can we ensure, if they need a stamp or something like that, you know, kind of working through the logistics so that they can represent themselves as needed. So that's something to consider. And then I am seeing some folks indicate, you know, well, this has been confusing because you've gotten mixed messages. Completely understand. But know that the attestation part and getting the signatures has always been the same. It's whether or not they were to be turned back into SDS, like to resubmit it. And just to be honest, it was really confusing because a signature page was just turned in and people didn't have any context to it. So SDS was like, this is not sustainable because we're getting just these random signed documents that we couldn't, and I shouldn't say they were random. Obviously you're turning them in with purpose. Like clearly you're trying to get it done. So I take that back. It was not random, but it was not easy to file in the Harmony data system because it's not like putting it in a file in a physical folder. Harmony is like, as you know, it's very complex in like where things are stored. So it wasn't feasible to do that in live time and submit it. And the real goal here is for you to just do a file review when you renew. Like you do that anyways. I mean, when you prepare for your planning team meeting, you're doing that. Just take a look and make sure that you have signatures on your attestations. It's not happening yet. The PHE is in effect, and this will be 6 months from after the PHE. It'll still be in effect. We're just trying to give you tools so this doesn't sneak up on you and then you're like really kind of in a hard place. We really don't want that for you. So we're just trying to give you tools to like Kat said, really protect your practice in ensuring that when somebody attested, they truly like agreed to that document during a pandemic. So when does the PHE end? The state PHE, so state federal, right? State federal. The state one ended. The federal one is still in place. We do not have the end date for it. Somewhere, sometime in the future, when it ends, it's going to be a big deal because so many things will have to be shifted, and we have 6 months from that date to shift it back. So the red carpet will be rolled out. There will be trumpets. Billboards will be flashing. You will know when the federal PHE ends.
Okay. All right, lots of different thoughts here. If we don't call them out specifically, don't worry, we still get everything that you're writing. A couple of scenarios where folks weren't able to get to do a visit because of the snow and things like that. Those are the kinds of things that you would document. You could go back and ask for signature later. Folks are asking about an attestation form that covers a date range of case notes. Maybe we could just get better clarification on what the expectations are around case notes, okay, before we address all the questions about case notes and signing case notes.
Those are like separate from what we're thinking about.
Right, like our understanding is that you don't have to have your own case notes signed unless you have some kind of a visit log or something like that. That's, you know, your agency or you are implementing, that's different. But our understanding is there's no requirement for case notes to be signed by the recipient or the guardian. So if somebody wants to kind of explain maybe what you guys mean by case notes, that probably might help us.
Our scope of this conversation is the support plan and applications, okay? Like and amendments, like anything support plan related, AppK, like amendment, full plan, whatever. Same for applications and expedites, anything like that where it drives the, becoming active on waiver services or renewing to continue, okay? That's where those documents.
So
And
they're saying the
if,
home visit forms is what is needing to be signed to show that they went to the home, talked to the client, and they would get it signed and dated either by the client or guardian, or if it's an assisted living home, they would get it signed by the nurse, CNAs, someone to verify that they made their home visit. So that sounds like the form that they're talking about. I don't know what the other case note form is that they're looking for.
Yeah, we have in our training a home visit template that we put forth as a good example, but it's not a requirement and regulation for the person to sign it. So, we're not sure where that's coming from. And I'm thinking about all these different things, like I'm wondering if some of these are from the requirement for people to have informed consent for virtual visits that are, done by non-encrypted virtual method, distance, telehealth modality. Telehealth modality notice, right? We're talking about with this conversation about attestations are the forms that you have that authorize services, okay? Not necessarily the case note question, okay? Or home visit note question or home visit form question. If it's home visit form, some of us are looking at it through the lens of assisted living licensing too. So maybe there's a form from them. We just don't know right now. We're not sure exactly what you mean by that. Care coordination monthly contact form or something that you devise that's your record of your visit. Certainly in regulation, there's a list of activities of care coordination that are within the world of monthly care coordination visit contact. Okay. So, those themes and topics are a reality. That's a regulation requirement. But specifically signing a home visit form with a particular form that comes from the state, somebody from the state, is not something that we have knowledge of right now. That's what we're asking for clarification on. And it's okay if we don't have it. We can certainly discuss in our teams. Folks are saying years ago signature was required. Yeah, the regulations have changed. There's been signatures of the person getting the services required for different things over the years, all across the spectrum of the long-term services and supports to include PCA. Okay, so a lot of us get those kind of things, including myself, get those things, gathered up together in the same concept. And they do change. They required them, then they didn't require them.
Okay.
Certainly, and I was like, we could certainly check with our policy unit just to make sure that we are understanding the regs correctly. And if maybe we missed something, which I doubt we did, but we could certainly double check and make sure that there's not something that we had over,
Well, I appreciate this because this helps us kind of understands like some of the chaos and why this is difficult. So we have a bucket of information that needs to be sorted through on documenting contacts, including that telemedicine modality, all of that. That's like one separate piece to this, and you have questions on that. We've noted that, and we're going to do research. We are exploring a documentation CEH. So this is something that we are already in the works on, and we're just going to dovetail this into it. For this session, so that's what we're here, like this session that we're working on today and talking about verbal attestations, we're really talking about applications, expedite forms, and every variation of support plan that you can have, whether it's an amendment, an initial, a renewal, to whatever, if there is a verbal attestation to it. Please check when you're getting ready to do your planning team meeting if you have any of those since the PEH started, which was March 2020. So looking back from March 2020. So for those of you, like, honestly, you guys are already starting to work on March, right? Like, because you're getting your planning teams ready for March. This is the time to start checking for those and verifying that you have signatures. It may be that your caseloads have them all the way up through a certain point, and then the communications got a little messy, and you may have discontinued that practice, or you continued all the way through, or you haven't collected any. It's okay. Like no judgment. You're not in trouble if you're in any one of those, or if your cases are all sorts, you're not in trouble. You're not, like, we're trying to talk to you about this now because we want to, like, this is one of the classic examples that Lynn gave about building the ship while steering it. And we're still on the boat, we're still steering it. Right now we actually have the blueprints, so that's great. And we have the map, and we're going to land at the end of this PEH with those attestations somehow documented, right? That's really the goal here. So you've got it. Just do your best practices in documenting the scenarios, the situations that as you know them, because you can only document what you know, and do your best. We know that that'll be awesome because you guys are really doing amazing work considering the dynamics that we've had in the past 3 years, and that we're in a rural environment with limited resources. You guys are doing an amazing job. So I think we're at time. Is there any other thoughts you guys had before we were done?
If we didn't cover a topic or you had a question we didn't answer, just send us an email. We'll get back to you on that. And again, we are sorry that it's not really the agenda that we had hoped to have for today, but happy 2023.
Yay! We're glad we're in it with you, that's for sure. You guys are awesome.
One question is dates of info share. It's the first Tuesday of every month. I don't have the exact dates.
There was a question. Yeah, there was a question about our info share in July. It fell on July 4th. So for that one, we're going to offer a recording that you could register for, just that one, so that you can get an email that says you attended it. And then we don't have that one at the end of the year in December of 2023, just because when you make these meetings and GoToMeeting, they only let you do it for a year. And we just run out the month before the end of the year, and we just make a new series so that it'll keep on going. All right, it's just kind of how it fell. So it compasses most of the year, but that final month, we'll give you new ones to register for that, and a year after that. Go-to thing. All right. Well, thanks again, everybody. We'll go ahead and end our session. Thanks for spending time with us here today. Always nice to hear from you and get your great questions and information. We greatly appreciate what you do. Happy New Year. And don't forget about our care coordinator office hours. And we'll see you next time. Thanks, everybody. Happy New Year. Bye for now.
Happy New Year.